Welcome to Ask Dr. Mingle, the Q&A series from Mingle Health answering your questions about quality programs and the transition to value-based care. I'm Kyle Breckel. I'm the Digital Marketing Specialist here at Mingle Health, and I'll be hosting this episode along with Dr. Dan Mingle, founder and CEO of Mingle Health. Hi, Dr. Mingle.
Good morning, Kyle. And good day to all of you tuning in. It's great to see you again. I'm Dr. Dan Mingle. I'm here to answer your questions to the best of my ability.
Well, we have two great questions for you today, so if you're ready, let's get into them.
Bring them on, Kyle.
Okay, our first question for you today, Dr. Mingle, is from Jason. And Jason asks, if an ACO fails APP Plus reporting in 2025, how would that impact them if they don't have any shared savings to lose? And does it make a difference if the contract is two-sided?
Wow, great question, Jason. Now, there's likely to be an effect in either case, whether it's one-sided or a two-sided ACO contract. The range and the scope of the effects differ for the one versus the two-sided contracts. Now, if it's two-sided, that means, for those of you just tuning in, that the ACO is contracted to share in savings and in losses. That's what makes an ACO an advanced APM. Now, if there are neither savings nor losses for the year, their participating NPIs who have QP status, that is the qualified participant status, will not suffer from a low or absent quality score. So it is tempting and maybe for some of you wise not to invest in quality reporting if you're expecting to have a poor score. Although that's a whole nother issue. We could maybe I'll extend on that at some other point. If there's savings, the APP Plus score must hit at least the quality standard or higher to collect all of the shared savings due. But even a low score can qualify for partial collection of the shared savings. Now, if there's a loss without a quality score, the ACO's share of losses is at the maximum. A score at or above the quality threshold reduces the loss. Now, there are often MIPS liabilities, and this is the issue for whether if you're considering not investing in quality reporting at all. There are often MIPS liabilities, even in advanced APMs, and the lack of an effective APP Plus submission could be important. And I'll explain that shortly. Now, if it's a one-sided contract, that means that the ACO is contracted to share in savings, but not losses. Or there could be in the agreement what Medicare calls a nominal share of the loss, a small amount of loss, which is not enough to qualify for advanced APM status. Now, those ACOs are considered MIPS APMs. They're in an advanced payment model. They still have some benefits of being in that advanced payment model, but they're still liable for MIPS. Now, all of the participants in an ACO that it's a MIPS APM are still subject to MIPS scoring and adjustments. So if there are no shared savings for the year, there's no savings for the year to share in, the APP Plus score is irrelevant to the collection of shared savings. If you know you're not going to score well, there will be no revenue boost from shared savings to pay for the reporting effort. There is, though, a MIPS implication that needs to be considered. Now, there's always MIPS implication in ACO contracts that are considered MIPS APM contracts. There are usually MIPS implications in ACO contracts that are considered advanced APM contracts. The MIPS implication in those advanced APO contracts, or the so-called two-sided contracts, tracks to QP, qualified participant status. QP status depends on the percentage of patients seen or the revenue generated that relates to Medicare patients in general versus the ACO attributed Medicare patients. So if you have hit those markers, those thresholds, on one threshold you become a qualified participant. With a lower threshold, you become a partially qualified participant. All participants in ACOs of the MIPS APM type have a MIPS liability. Non-QP status participants in ACOs of the advanced APM type have a MIPS liability unless there's another reason that they're excused from MIPS, like small or low revenue threshold practices. Let me mention here that the partial QP applicant to a partial QP is someone who hits a lower threshold but not the full threshold to become a qualified participant. Partial QPs have choice, so if they choose to be MIPS liable, these comments apply to them. If they choose not to be, then they don't apply to them. The APP Plus submission has 3 implications for all ACOs, both MIPS APM and advanced APM style ACOs. First, it determines the qualification to collect any shared savings generated. You hit the threshold and you collect all your shared savings, and there's a kind of a phase-in approach even under the performance threshold where you collect part of your shared savings. Second, it can protect against full liability for shared losses. It doesn't hit you completely if you meet or exceed the quality standard. And here's the important part. Third, it serves as a MIPS quality score for MIPS liable participants in the ACO. So any of your participants who are liable for MIPS can use the APP or the APP Plus data quality submission as their MIPS quality score. Now, MIPS liable participants who don't have a MIPS score at all will suffer a full 9% negative adjustment on all Medicare Part B payments. 9% is a big loss. Even a low quality score, when considered in combination with the other ACO relevant scoring dynamics, can eliminate or at least significantly reduce the potential negative MIPS adjustments. And that could be very important and should be taken into consideration as you think about whether or not to make that APP Plus submission. Now, you should be considering for your MIPS liable participants as an ACO, or they should be considering for themselves an alternative MIPS quality submission. Now, those MIPS liable participants will be assigned, relative to the calculation of their MIPS adjustment, the best quality score submitted on their behalf. So if they get an APP Plus score, a group MIPS submission score, and an individual MIPS submission score, it can even be more complicated because you can put in multiple varieties of each. They will get the best score assigned to them for MIPS. So if they've made redundant submissions, if you fail to make an APP Plus submission, they'll still get scoring from something else. And it may also be important for those who will score higher on their own than they will combined with everyone else. They may want to do their own anyway to get a higher MIPS adjustment. The bottom line is that you have to think about MIPS in your ACO, whether you're an advanced APM or a MIPS APM. You might conclude it's the responsibility of each practice to think about whether or not they would benefit from a group MIPS submission, and it's the responsibility of each individual provider or their practice to decide whether or not they would benefit from an individual MIPS submission, but it is applicable. I'd also argue that even if you expect to score low, it's important to submit just to build that mechanism to collect, aggregate, and send the data. Those aren't trivial issues. You need to identify how you can increase your scores to eventually. You're not in a shared savings program to avoid collecting the shared savings. You want to do it. You need to do it. You have to invest and work in a sustained fashion to getting to the point where you can collect it. Well, I hope this has been helpful. It may be a little bit more complicated than I'd wished it was, but it makes sense. So make sure everyone gets that quality submission in.
Thank you for the great question, Jason. And our final question for you today, Dr. Mingle, is from David. And David says, the big implication for us in the quality payment program rules for 2025 is the requirement that 100% of our ACO participants need to be on certified electronic health record technology, also known as CEHRT.
You're right, David. That has a big implication for all ACOs. As a reminder for all of you, before the 2025 reporting year, ACOs that were advanced APMs had a contract requirement that 75% of their participants were using certified electronic health record technology, CEHRT. ACOs that were MIPS APMs had a 50% use requirement. Now, starting in 2025, both groups are contractually required to have a 100% certified health record technology utilization. And all providers are also required to submit a promoting interoperability MIPS performance category submission. No question, this is hard and may force some practices to leave ACOs or ACOs to reject some practices. Now, there are some other factors remediating that new ruling that fall under the categories of good news and bad news. So let's walk through those. First, good news. The exceptions that have always existed for CEHRT use, as evidenced by promoting interoperability, equally apply now to the ACO requirement. So despite the 100% utilization requirement, all of the exceptions still in force year by year apply equally to ACO use of CEHRT as they do for MIPS CEHRT use requirements. So both automatic exceptions and exceptions granted on hardship application apply. Things like small practices, having 15 or fewer providers in the practice, non-patient facing practices or providers, facility-based providers. Now, hospital-based and ambulatory surgical center-based providers should be automatic, unless, of course, they divide their efforts between multiple facilities. But if you don't fit the automatic exception, if you're facility based, and for others, you can make a hardship application, and those are typically readily accepted. And so, if you're accepted for a hardship application or have something automatic, you're also exempt from the use of CEHRT in ACOs. Now, second, bad news. The final rule for 2025 cues for the 2027 performance year, so that's looking ahead 2 years, sunset of the MIPS CQM option for the APP or APP Plus reporting. If this is not modified before then, and I'm going to continue to lobby for it to be changed, I think it's foolish for CMS to sunset MIPS CQMs for ACOs. It just makes it too hard without adding any value to your reporting effort. If this is unmodified by 2027, you will need to make either an eCQM submission or a Medicare CQM submission. With Medicare CQM submissions, the standard CEHRT, the certified use of EHR, all those exclusions will still apply. But eCQM utilization will effectively end the applicability of the CEHRT exclusions. You have to have CEHRT in order to make an eCQM submission. So your practices that qualify for one of the CEHRT exclusion criteria will still have to have CEHRT in order to contribute data to your APP or APP Plus quality reports. Finally, one last piece of good news. You can use the data completeness requirement to modify your CEHRT requirement. That is, data completeness requirement for this year, 2025, and next 2026 remains at 75%. It's not yet set for years after 2026. It could go up to 80% in 2027. Who knows? But whatever the data completeness requirement is, you can spend it on practices without CEHRT. With that limitation in mind, you can still have practices without CEHRT in your ACO, but only to the extent that you can still generate electronic data analysis applicable to enough of your denominator patients to be at or above the data completeness requirement. So a little bit more complex, and you don't have as much freedom to use your data completeness requirements for other things, data access issues, data transmission issues, things like that. But it's not. It can modify that CEHRT requirement. So good luck. I hope that along with me, you continue to comment to Medicare that it doesn't make sense to disallow MIPS CQMs. You should get, each of your practices should get the best possible score that reflects your actual performance and not bake in the technical requirements that are inherent to CEHRT reporting.
Thank you, David and Jason, for the great questions, and thank you, Dr. Mingle, for sharing your insight with us today.
Thank you, Kyle, and thanks to all of you for the great questions. I want to be helpful. I want this to be useful to you. Don't hesitate to correct or supplement my answers. Share your experience. Ask your questions. We can be smarter together.